Hi, everyone. Welcome back to the Nursing Insights podcast. I'm your host, Stephanie. In today's special episode, we'll hear a variety of perspectives on New Jersey's access to care crisis. It's so important that we educate the nursing and healthcare community as much as possible on advanced practice nursing and what it entails. Now, let's get started.
Hi, my name is Caroline Dorsen. I am not one of those people that ever expected to be a nurse. I do not come from a family of healthcare providers. But when I discovered what nurse practitioners do in the late 1980s and early 90s, I realized that this is what I wanted to do for my career. I found that nurse practitioners who I met along my road were passionate educators, clinicians, teachers, advocates, and I thought that that is what I wanted to do. I am really concerned about the state of healthcare in the state of New Jersey and nationally. My passion has been the intersection of health and social justice. I have worked my entire career as a family nurse practitioner and nurse educator to reduce healthcare inequities. And in New Jersey, what we see is that we not only have huge healthcare disparities, but we have huge workforce shortages, which means that we currently do not have enough primary care providers to take care of our population. And then the number of primary care providers that we currently have is dwindling. So these workforce shortages are going to get worse as we move forward, and we are going to be less able to take care of our population than we currently are. Full practice authority for advanced practice nurses in New Jersey will remove what is really just an administrative barrier to practice. There are APRNs who are excited and ready to work in New Jersey to provide primary care and other types of care to the population, and this is so desperately needed. But our current bills add an administrative restriction that causes financial barriers to APRN practice and administrative barriers to APRN practice. I've been a family nurse practitioner for over 20 years. In order to be a family nurse practitioner, one has to have a bachelor's in nursing, as well as a master's degree or a doctoral degree to be a family nurse practitioner. In my case, I had a bachelor's degree in another field. I studied anthropology and then decided I wanted to be a nurse practitioner. So I went back to school and I got a second bachelor's degree, I got a master's degree, and then I went on to get a PhD and do a postdoc. So I'm both a nurse practitioner, a nurse educator, and a nurse researcher. Even though I've been a nurse practitioner for 20 years, the majority of that time has been practicing in the neighboring state of New York. When I decided to move my academic practice to Rutgers, I made the difficult decision not to move my clinical practice to New Jersey, in part because of the practice restrictions in the state. I would love to practice in the state. I would love to continue my work reducing health inequities in the state by providing expert primary care to diverse populations. But at this time, I've decided to keep my practice in the state of New York. Full practice authority in the state of New Jersey means that nurse practitioners and other APRNs can practice to the top of their license. This does not mean that we're not going to consult with our physician colleagues. This does not mean that we're not going to have a collaborative practice. All this means is that we don't have an administrative barrier to practice. We will still be the team players that we have always been, working with our colleagues from across the healthcare continuum. Healthcare is currently in a crisis, a workforce crisis, and we need all hands on deck. By removing this administrative barrier to practice, we will be able to utilize all of the APRNs in our state to care for our population. Other states are successfully doing this and are reaping the rewards of having a more robust workforce. There is a projected shortage of over 1,000 physicians in the state of New Jersey. We need all of our APRNs to stay in the state taking care of our population. During COVID, APRNs were allowed to practice to the full scope of their license. This was an important moment in our cultural, social, and medical history in the state. We needed all hands on deck to take care of people in crisis. Unfortunately, even though COVID is not as big a crisis as it was, we still have a crisis in healthcare in the state of New Jersey. We have a health disparities crisis. We need everybody in the state who can care for patients to do so, and that means physicians, PAs, APRNs, midwives, CRNAs, and everybody else. This is a moment for us all to work together in order to care for our population and reduce health inequities. New Jersey is in a real healthcare crisis. The New Jersey legislature needs to grant advanced practice registered nurses full practice authority to lift the burden.
So my name is Vicente Gracias. I live in Cherry Hill, New Jersey, and have spent the majority of my professional life in trauma surgery and in teaching surgery and healthcare. The rest of my life I spend as a husband and the father of 3 children. For me, part of what I wanted to do was to evoke change in the world and in what I felt was a meaningful calling to be a doctor. Surgery certainly was an area that I found very challenging and at the same time enormously rewarding. And I wound up in trauma because there was an enormous amount of social merit to it. I felt that I could evoke the most amount of good there, and it made me feel actually very joyful while I was doing that work. So I spent an enormous amount of my professional life fighting trauma injury, all of the different ravages of what happens, at least in America and around the world, when it comes to the inability for people to live peacefully. And trauma surgery gave me an opportunity to really evoke some change, either through the operating room or through a lot of the outreach that many trauma centers also perform, not just in America, but around the world, to try to bring more comfort and awareness to the prevention of trauma. Trauma can be everything from disaster to gunshot wounds to even now behavioral health issues that we're wading into after COVID, understanding full well in our responsibility for all the populations that we care for. So I think trauma surgery really gave me an ability to work in the operating room on one-on-one, but then also trained me and helped me see the larger lens that we're all connected at the population level, and really helped me to understand and how to move from the individual all the way up to New Jersey, the United States. The physician workforce, the nursing workforce is spectacular in New Jersey for all sorts of reasons. Its proximity to Philadelphia, New York, the Jersey Shore. So you can work as hard as you want. You can enjoy your life as well. And people then gravitate to New Jersey as a way of working professionally, at the same time balancing their lives. That's given New Jersey an opportunity to create an outstanding workforce in what I do for a living, which is delivering healthcare or training the future workforce of healthcare. On the flip side, I do think not just the pandemic, but unfortunately in New Jersey, there are areas, including maternal and fetal health and newborn health, that there's room for improvement, and several other areas. Even as we learn and evolve, our access to behavioral health is something that we could certainly improve. There's certainly areas of enormous success, and there's enormous gap. And I think what we do best in New Jersey, and I mean this for everyone that works with patients and with trainees and learners, is we can actually see those gaps. Don't rest on our laurels, wade into the gap, and we try to make things better. There's certainly room for improvement. We can complicate it with all sorts of legislative titles and political machinations, or we can simplify it. I would rather simplify it. The removal of a collaborative agreement between 2 professionals allows both professionals to then work autonomously and in collegial partnership. If we have a collaborative agreement where one colleague does in fact have a professional and legislative authority over another, that can be constricting. It can be viewed as competitive, and it can certainly be viewed as restrictive. Here in New Jersey, that collaborative agreement has been used to stifle the growth of many of our professional colleagues, and that sometimes it has also helped to foster relationships. But the final outcome is really in the hands of whichever professional has the authority over another in that collaborative agreement. There is way too much room for human characteristics to enter into that approach. Since other neighboring states don't have these types of agreements and actually believe in the literature that shows that both professionals can actually deliver similar outcomes in terms of access and care and quality, it puts New Jersey at a disadvantage. If you have the opportunity to work autonomously and as a partner of equal worth and equanimity with someone else, I think the majority of people in America would pick that. If you don't have a choice, then you may wind up saying, this is the best opportunity I have, and you will accept that restrictive authority. Unfortunately, in New Jersey, most, if not all, of our neighboring states do not have these similar restrictive collaboration between APNs and physicians. So in New Jersey in particular, we are suffering enormously from the most talented individuals who have the opportunity to go anywhere, avoid New Jersey, either because of the collaborative agreement or the simple fact that in America, you have the right to determine your own future based on your effort. And so many of the best view this as not just a nuance, but a real restriction on their ability to achieve an equitable partnership and practice when they're out with patients and teaching. So we have lost not just outside trainees, but over the years, we have been able to accumulate data that, in fact, even those APNs that we train here in New Jersey, and we have some of the best nursing schools in the country here in New Jersey, actually leave New Jersey to go to neighboring states because they feel that they have much more of an equal authority and autonomy. That's created a workforce gap. The nursing community has done a wonderful job, as have many others, in generating data that shows, in fact, that the outcomes in terms of quality and output as a health product or training product is equal between doctoral APNs and physicians. So I think I would rather speak from the point of view of an enormous amount of experience as a trauma surgeon and as an educator in healthcare, having now watched the more interprofessional health approach to caring for patients and for training. It is the future of medicine and the way we deliver healthcare. My feeling really stems not just from decades of experience of working with nurses, APNs, doctoral APNs, and other interprofessional colleagues. It allows us to work collegially, where everyone's valued opinion is actually shared, listened to, and ultimately removes the physician, and in sometimes especially the surgeon, from the center of attention and the CEO type of position, and puts the patient in the middle of that circle. I honestly think that the more we move toward a interprofessional approach where we have to respect each other, and certainly right now the limelight in New Jersey is on APNs and doctoral APNs, but in fact the idea and the philosophy of listening to each other with respect, I think in the end improves the overall quality and care of the patient, but keeps all of our egos in check and allows that patient to remain the center of everyone's focused approach. As medicine becomes more and more complicated, and now, from my understanding, someone said this to me, so you'll have to check, but if you look back 20 years ago or so, medical knowledge increased every 6 or 7 years. Now, with everything that we're doing, including in genetics and drug therapy and on and on and on, that knowledge increases every 3 to 4 months. Doubles. So if you can imagine how difficult, if not impossible, for one individual to actually maintain all of that data, not just in their minds or even with some tools as we improve our ability to use computers, it's impossible to digest all that to an expertise level. So more and more, we need an interprofessional team around our patient and our learners to care for them and teach for them. And I think that's probably the most important opportunity that we have here in New Jersey. If we're able to remove barriers that allows our interprofessional health education and interprofessional care to actually blossom, to shine, to create a respectful and equanimous environment. I think ultimately, since we have some of the best and brightest physicians and nurses and doctoral APNs in the country here, the patients are going to win, and we're going to continue to improve and deepen and enrich the learning environments that we have here in New Jersey. As we continue to train the best, we'll certainly retain the best, and every New Jerseyan will benefit from that. Every physician is comfortable that an APN or a doctoral APN can practice. The real question is, can they practice independently? And I believe that not just the data, it shows that in fact, in head-to-head comparison around primary care, behavioral health care, other areas, APNs deliver equal quality and value as do physicians. What I have and will add to the entire debate around their acting in an autonomous and independent way is having worked with APNs for more than 2 decades. And my own own experiential observations that, in fact, not only are they capable, caring and compassionate caregivers, but they're also lifelong learners, just like successful physicians. So for me, the APNs represent just more individuals that are willing to work because there's just not enough of us to deliver and to hopefully bring the best possible outcomes to our patients. And in New Jersey in particular, it's the same workforce in many ways that also teaches the future generation of nurses and physicians and other health providers. Without the ability to retain our doctoral APNs, it's just going to become more and more difficult, if not impossible, to teach all of the people that want to be trained and then ultimately have the workforce that we need to take care of all the patients that we have here in New Jersey. I think the restriction can be divided into many different pieces. I'll concentrate on two. One is the restriction of autonomy. And in that case, the collaborative agreement is viewed by especially the best and the brightest as an artificial attempt to restrict one's practice. And when that restriction isn't present in other locations, who would choose where the restriction is? I don't think anyone would. You would rather practice as independently as possible, unless there's some reason that you have to remain within an environment that restricts you. The more talented you are, the more opportunity and options you have, the less likely you are to pick a restrictive environment. And I think that's very, very important in understanding that. And as other neighboring states remove those restrictions, because the data shows that the care that doctoral APNs can provide is similar and equal to that of physicians, it's becoming harder and harder for us to keep those individuals in New Jersey. The other point that I would like to make is that the legislation is so lax in its unfocused approach that collaborative agreement can be as restrictive or as lax as the physician chooses. So there are physicians that charge an enormous amount of money for a collaborative agreement for that doctoral APN to be able to work in New Jersey. And other physicians are very progressive in their thinking and review only one chart a year, which again, I would venture to say doesn't really create a quality control mechanism. So the latitude within the legislation is another ability for the physician, depending on their character, to be abusive or to be completely derelict in their oversight. And because of that, it really needs to be done away with. The data now shows that the most important part of good care is being present, to be a lifelong learner, and to care with compassion. And I believe those doctoral APNs that I've helped teach, those that train and work with me, can deliver that just as well as I can, just as well as any other physician. And the ability for them to work independently still continues to be, I think, why everyone works and lives and thrives here in the United States. I think for New Jersey, what it would mean is a path forward to be able to fill a growing workforce gap that we have here in New Jersey. I don't want to say that it is the only impetus because we have a workforce gap, then we should remove the collaborative agreement. I think that is in fact a true statement, but it's not the only reason to do that. Even if we did not have a workforce gap, we would want the best and the brightest to work here in New Jersey as they have for decades. The collaborative agreement, since it now only exists in the Northeast, here in New Jersey and some faraway states, and since our neighboring states have already eliminated this collaborative agreement, it actually puts our state at a disadvantage. So the fact that we have a collaborating agreement that in no way imperils the patient, but in fact restricts the practice of the APN, I consider it now to be an artificial restriction that actually forces many of the most talented APNs to seek out a more autonomous approach and a respectful approach between professional colleagues. As the workforce gap deepens and broadens, we now have no choice in many ways if we want to continue to retain doctoral APNs here in New Jersey, but to create a level playing field.
Hi, my name is Donna Gaffney, and I'm a patient of an advanced practice registered nurse. In fact, I'm a patient of several advanced practice registered nurses. Not only have I been a patient of an advanced practice registered nurse, but my daughter and my son have also been patients. When my daughter was old enough to get her first well-woman exam and meet with a person who would sort of guide her through the process of what it means to care for your body as a woman, I selected a nurse practitioner in my community who was very well versed, not only with women's health issues, but with young women. And the reason I chose her is because I knew that she would get the education that she needed that was so important for her health. She could talk to this person easily, she could call her, she was there for her when she needed her. So it was an absolute home run for her health care. I am also a patient of an advanced practice registered nurse. I have an ongoing history with vertigo. And the person who helped me sort this out and know what to do in those situations where my vertigo sort of acted up was an advanced practice nurse. And I would call her, and not only would she teach me how to do the special maneuvers that would correct the situation, but she would follow up. And it wasn't something, she didn't refer me to a physical therapist, she didn't refer me to somebody else. She is an ENT specialist as well, but she taught me exactly what I needed to do. And every time I would go back to visit her, we would talk about, if I had sinus infections, and she's the one that told me, well, you really have to make sure that you're taking decongestant and do the neti pot, and she had the whole list of things that I should be able to do in order to deal with my sinus infections, but she was so skillful at all that I can't imagine not having her in my life. My decision to see an APN is not necessarily based on who can see me sooner. It's based on the quality of that interaction that I have with this individual, that I can talk to this person, he or she can listen to my history, they can advise me. So I think that it's really important to go to this individual because of the kind of services they provide. And of course, if I was in an emergency situation and I was offered to see an APN, or maybe wait to see another provider, another discipline, I would not hesitate for a minute to see the APN, not for a minute. I do have primary care providers and primary providers that I rely on, but when I choose my primary provider, I always make sure that there's an advanced practice registered nurse who is on the team, because I want to know that I have the option of seeing that individual. Sometimes waiting for a while to see someone is not acceptable. I want to address an issue right away, and I will make sure that I can really see someone who I can trust and believe will provide the most comprehensive assessment and recommendations. And so whenever I talk to my colleagues, my friends, and they are, say, choosing a pediatrician for a new baby, I always tell them, choose your pediatrician well, make sure that there is a pediatric nurse practitioner in that practice as well. I think access to healthcare providers in the state of New Jersey, as in the entire country, but we really feel it here in New Jersey, is a real problem. And we need to do everything we can to make sure that our citizens get the care that they need when they need it, and not monitor or restrict practices based on outdated and useless legislation. My experience with APRNs and nurse practitioners has been always incredibly positive. I am confident in the work that they do. I am trusting of them. I think that they, above all, really know how to talk to patients and instruct patients and educate patients to keep patients healthy. And so I really believe that we need to, have more of these APRNs in the state. And I would absolutely feel full confidence with an APRN. I think New Jersey needs to catch up to what the other 27 states and District of Columbia are doing. I'm not sure why New Jersey thinks it is different, other than there may be strong lobbying people who want to keep things status quo. The only time they don't want to keep the status quo is when there's an emergency, a pandemic, a 9/11, a hurricane. Then it's okay for APRNs to practice. That just doesn't make any sense. I think it's really unfortunate that New Jersey is losing its advanced practice registered nurses to other states, primarily New York, Delaware, and Maryland, who offer full practice authority. I will tell you that in my relationship with my provider, if I found out they were leaving to go someplace else, I would follow them. So this message is for you, lawmakers in Trenton. If you care about the citizens of this state, you will offer to APRNs full practice authority. Stop. This is what our state needs. There is no reason for New Jersey to be behind the other states who are offering full practice authority. Now is the time. Every single person, every patient, every family, every community, every school needs to let you, lawmakers, know this is no longer acceptable. As a patient and as a recipient of health care in this state, I will do everything in my power to educate my friends, my colleagues, my neighbors about the value of advanced practice nursing and how advanced practice nurses provide the exact same services and maybe even more to each of us. I will reach out to my legislator and ask them to pass access to care. It is time.
Thanks for listening, everyone. We'll see you next time on the Nursing Insights podcast.